Are you tired of using your dog as a therapist? Are you ready to make a difference and take your furry friend on a much-awaited walk? Here at 2 Steps Clinic, we encourage our clients to take initiative of their life and heal from unresolved dilemmas. At 2 Steps Clinic, we utilize psychoanalysis founded by Sigmund Freud in the 1850s, which focuses on the repressed memories and feelings of a client and resurfaces them to help them heal. Freud believed these dilemmas occurred because of failed psychosexual stages in the first 6 years of a client's life. Due to these disturbances, anxiety and ego defense mechanisms develop to help protect a person. This unconscious material appears through a person's behaviors, emotions, thoughts, and even dreams. Maybe hitting the snooze button isn't such a bad idea. Furthermore, this theory analyzes the patient's personality, the id, the desires of a person, the ego, the mediator of the superego and the id, and superego, the strict moral standards of a person, and life instincts such as surviving or procreating, and death instincts, risky behavior or reliving trauma. This is what drives a person's life. To help better our clients, there are a variety of psychoanalysis techniques our clinic utilizes. 1. Maintaining the analytic framework. This pertains to the goals of therapy, such as the length of sessions, cost, and limitations. This will limit the emotional stress of a patient. Number 2, free association. This allows the client to speak their mind about a variety of topics without limitations. Definitely do not mean gossip. This technique helps the unconscious surface through past events or repressed intense feelings. Clinicians will analyze all aspects of the client's words to identify repressed and anxiety-inducing material. Number 3, interpretation. Therapists identify, explain, and translate the significance behind the different aspects of the client's life, such as dreams, transference, defenses, etc. This enlightens the patient's concept of life and reveal more unconscious information. Therapists must be wary of the client and how prepared they are to interpret their unconscious material. This concept is essential to not diminish any report built. Number 4, dream analysis. The unconscious may not be repressed during sleep. Therefore, dreams become manifestations of unresolved problems. This material may be transformed into conscious material through the application of interpretation. These two go hand in hand. Number 5, analysis of resistance. The production of resistance gives a clinician a cue that this material may cause the client anxiety, pain, or other feelings. As said information was brought to life. Let bygones be bygones, am I right? Wrong. Resistance means the client does not want to accept change, a change that could be beneficial to them. Analysis of transference. Number 6. Clients may exhibit similar patterns of past or present relationships in their environment towards the therapist. This provides insight to the clinician on what information needs to be addressed. Furthermore, this may allow patients to become self-aware and revise their behaviors, thoughts, and feelings. According to Peter Fonagy in 2015, a study was completed throughout 18 months between psychoanalytic therapy, the experimental group, versus cognitive behavioral therapy, the control group, for adults with depression. Both groups exhibited similar benefits. However, 2 years later, 44% of the psychoanalytic therapy patients no longer met criteria for major depression. Another study conducted by Fonagy in 2016 examined the parent-infant psychoanalytic therapy to improve the interaction between both parties. In terms of measurement of newborn development, parent-infant contact, or the parent's capacity to take into account the baby's mental condition as well as their own, the authors observed no significant differences in results for either intervention. However, parents that received parent-infant psychotherapy expressed improvements on maternal mental health, such as less stress and positive views as parents. Go parents! Therefore, at two-step, the use of psychoanalysis provides our patients with a variety of techniques and supportive evidence that would assist through difficult times and unresolved dilemmas. Prepare to make a difference? By simply making a call and going to get help, you take 2 steps to better yourself. Welcome to Two Step.